A systematic examination of the lungs and thorax will give a clear assessment of how well the respiratory system is functioning. The success of the exam depends on your ability to be both thorough and observant. Think of yourself as the detective conducting an investigation into the respiratory system. Some of the clues are visual, some are tactile, still others are auditory. That's why it's so important to perform each step of the exam, inspection, palpation, percussion, and auscultation in a systematic manner. As you watch this demonstration of the respiratory exam, pay close attention to the specific techniques of the examiner. These are the techniques that will enable you to detect respiratory problems.
Have you had a cough recently, Billy?
No.
Have you ever had chest pain?
There is more information gathering here than you might expect.
Are there times when you
Even while the patient is wearing a gown, you can make general observations about respiratory function. Observe that this patient's posture is normal with his shoulders back. He is breathing easily through his nostrils. These are both signs of a healthy respiratory system. During the actual exam, you will test and retest the significance of these original signs.
We can begin the exam now. I'll take your gown down. Okay, Billy, I'm going to start by examining the front of your chest, and then I'll go around the back and do the same. I'll be looking at your chest, listening to it, feeling and tapping, okay? And as I go along, I want you to stop and ask questions if you have any.
I will.
Sometimes clues can appear in areas outside of the organ system you are investigating. Check the lips and earlobes. They should be pink, as this patient's are. A bluish coloration of the skin and mucous membranes would indicate cyanosis. Check for cyanosis in the fingernails. This patient has the normal pink color. Now you can begin to inspect the anterior thorax directly. The costal margin forms approximately a 45-degree angle at the sternum, as it should. The relative position of the clavicles is symmetrical. This is normal. Continue to watch the thorax for at least 30 seconds, counting the rate of respirations. The inspiratory phase should last longer than the expiratory phase, as it does here. Males use abdominal muscles for breathing. This is less true of females, who breathe more from the diaphragm. Patients with an obstructed airflow tend to use accessory muscles to assist breathing. Check for strenuous muscle activity in the supraclavicular area. Look for it also in the intercostal spaces.
Okay, so far everything looks great.
What are you looking for?
Well, I'm just watching the way you breathe right now, and both sides of your lungs you're moving equally so that we have equal distance as you breathe in. And it looks great in the front, so I'll just take a look from the side.
The anterior-posterior diameter should measure approximately half the width of the transverse diameter. An increased AP diameter is abnormal. A convex thoracic curve of the spine is normal. However, the convex curve of this spine is somewhat exaggerated.
Now I'll be feeling around the notch in your neck, so I want you to try and relax your neck muscles, and I'll warm my hands up.
To check for tracheal deviation, place your middle finger just above the sternal notch and feel lightly. When you have felt the trachea, move your fingers to either side. The trachea should be positioned in the middle of the sternal notch at a depth no greater than 2.5 centimeters.
I'll be applying a little pressure on the front of your chest. I want you to tell me if there's any areas of tenderness, okay? How about there?
It's fine.
Okay. How's that?
That's okay.
Okay, good. Now, the lymph nodes up in this area sometimes get enlarged. Yours feel pretty good. Nothing there. Okay, there's another set here. Okay, that's good. Can you raise your arm for me? Good. Oh, it feels fine.
A test for tactile fremitus can help you determine if the air passages are aerating properly. Start at the apices of the lungs by placing the palmar aspects of the metacarpophalangeal joints of your hand above each clavicle. Ask the patient to say 99.
99.
Repeat this several times as you move your hands downward over each lobe of the lungs.
99.
If the patient is breathing
99.
properly, the vibrations will be symmetrical
Once more.
and will
99.
occur
99.
only when the patient
Good.
speaks.
Now, do you remember I told you that when you breathe in and out, your lungs should be moving equally on both sides?
Yeah.
Well, I'm going to be putting my thumbs right here on your rib cage, and I'm going to ask you to take a deep breath in. And if you're breathing normally, you should be moving equally on both sides, so that when you breathe in, my hand should move out, and when you breathe out, they should return to the normal position. Okay? I want you to take a deep breath in. Good. And let it out. Okay. Now there's some other sounds that I can use to tell something about your lungs.
The
And I
sounds
get
produced
those
by
tapping on the
percussion
front
can
of
give
your
more
chest.
clues about the level of respiratory functioning. These are the areas you will percuss. Begin above the patient's clavicle and move from one side to the other to check for symmetrical resonance. If the patient's lungs are aerating properly, you will hear resonance over the entire lung field. The areas over the heart and liver will sound dull.
Okay, that's a healthy sound. There's a few more sounds I can listen to. For that, I'll need my stethoscope. So I'll warm it up a bit. And while I'm listening, I want you to be breathing through your mouth, okay? Just a little bit more deeply than you usually do.
You will listen over the following areas for vesicular, bronchial, and bronchovesicular sounds. Listen in each of these areas for a full respiratory cycle.
Okay, breathe through your mouth.
Using the diaphragm of your stethoscope, begin listening above the clavicle. Remember to move from side to side to check for symmetry.
Deep breath. Again.
These are vesicular sounds. Listen over the trachea where you would expect to hear bronchial sounds. As you listen over the bifurcation of the bronchi, you should hear bronchovesicular sounds.
Okay, your lungs sound great. I'm going to go around the back and do more of the same. Okay?
Inspect the posterior thorax, checking for symmetry. Notice that there is a slight downward drift to this patient's right shoulder and scapula. The configuration of the spinal column should be vertical, yet there is a slight lateral curve to this spine. The skin color is normal. Note that the ribs, as they articulate with the vertebrae, form approximately a 45-degree angle. This is normal.
Okay, Billy, I'm going to watch the way my thumbs move as you breathe in again. All right? Okay, take a deep breath in. Good, let it out. Okay, that's fine. Now we're going to do 99 again, just as we did in the front. Okay? Okay, 99.
99.
99.
99.
99.
99.
Normal vibrations
99.
of tactile fremitus will be symmetrical and will occur
99.
only when the patient is speaking.
Okay, once more. 99.
99.
Good. Okay. I'm going to do the chapping again, just like on the front. And I want you to cross your arms in front of your chest like this. Okay, great.
Percussion of a healthy posterior thorax will produce symmetrical resonance over the lung field. These are the areas to percuss. Begin percussing above the scapulae, moving downward, between, and then below the scapulae. Percuss from side to side to check for symmetry.
Okay, Billy. Now I want you to take a deep breath in, and blow it all out and hold it out, okay? Deep breath, and all the way out.
Percuss downward from below the scapula
Okay, hold
at
it
the
out.
mid-scapular line until you hear the sound of resonance change to dullness.
Okay, you can breathe normally.
This is the upper border of the diaphragm.
Okay, this time I want you to breathe in real deep and hold it in. Okay, deep breath in. Hold it.
Percuss downward again until you reach the new level of dullness.
Okay, you can breathe normally.
The distance between the 2 points is the distance the diaphragm has traveled during inspiration, about 4 centimeters.
Okay, we're going to do the same thing on the other side now. Breathe in.
Repeat this procedure on the other
And blow it
side.
all out.
The descent is
Good.
normally
Hold
1
it.
to 2 centimeters higher on the right.
All right, how are you doing so far?
Fine.
Pretty good? Okay, we'll be listening to your chest sounds again through the stethoscope. And I want you to breathe through your mouth, just a little bit more deeply.
If the lungs are aerating normally, you will hear vesicular
Okay.
sounds on most of the posterior thorax, with bronchovesicular sounds occurring between the scapulae at the level of the bifurcation of the bronchi. This is the sequence used for auscultation. Again, using the diaphragm of the stethoscope, begin listening above the scapula for a full respiratory cycle. Compare sides moving downward between the scapulae. Listen for the presence of any abnormal sounds.
Okay. Deep breath. Good. Deep breath again. Okay, one more time. Okay, that's it. Your lungs sound great. You can climb off the table now. And I just want to check one more thing about your back.
In recording exam findings, it is essential that you be specific. Merely writing normal is inadequate since it offers no useful information. The findings of the physical exam you just saw would be reported as follows. Inspection. Anterior-posterior diameter not increased. Lips and nail beds pink. Thorax slightly asymmetrical with lateral curvature of the spine. Full expansion equal bilaterally. Palpation. No tenderness. No enlargement of the lymph nodes. Fremitus equal bilaterally. Percussion. Lung fields resonant throughout. Diaphragmatic excursion 4 centimeters bilaterally. Auscultation. Breath sounds clear. No rales, rhonchi, or rubs. The respiratory system is one of the most dynamic systems of the human body. Even if a patient's history is normal, changes can occur at any time in response to changes in the internal and external environment. In order to detect these changes, it is important that your assessment be thorough, your skills sharp, and your methods systematic.